Welcome back, guys, to another episode of Juxtamed quiz. So today we'll cover ENT topic that is throat, that is pharynx, larynx, and the neck. So let's begin. Here's your first question. 45-year-old male present with progressive hoarseness of voice since 3 months. He has history of smoking for 20 years. Indirect laryngoscopy reveals an irregular growth over left vocal cord with restricted mobility. So what will be the diagnosis? A straightforward question. Think there is progressive voice change, there is smoking history. You can guess the answer. Yeah, right. This laryngeal carcinoma. Okay, we have Sriraj leading. We have Myra, Dr. Rita, Shanpriyan, and Hema. Okay, here's your second one. A 5-year-old child presents with history of fever, drooling, difficulty in breathing. On examination, the child is sitting in tripod position with respiratory stridor. So, what will be a diagnosis? So, this is actually a pediatric emergency. There is airway obstruction. The child prefers to sit forward, and it is often caused by a bacterial infection. There's an epiglottitis. Okay? Okay, a 30-year-old female presents with painless, slowly growing midline neck swelling that moves with swallowing and protrusion of tongue. So, what is the likely diagnosis? So, think of a developmental anomaly here arising from the embryological remnants. The classic finding is movement with tongue protrusion. Right, the answer is thyroid muscle. See the leaderboard. Here we have Sriraj, the first place champion, holds the second place, Mira in the third place. We also have Ashish, CK, RTT, Sudan, Pradeep Stark, RTT, Bhagya, C. Naka, Hemant, Saranya, Krishna, K. Sridhar. Okay, let's see the fourth question. A 2-year-old child presents with high fever, neck stiffness, and difficulty swallowing. Examination reveals bulging of posterior pharyngeal wall. So, what will be the likely diagnosis? So the options are easy. You can easily get. But what if the option was retropharyngeal abscess and parapharyngeal abscess, and the question had there is a midline swelling in the posterior pharyngeal. Right. Here the answer is retropharyngeal abscess because there is swelling in posterior pharyngeal wall. If it is a midline swelling, then we say it as retropharyngeal. If there is a one-sided swelling, then we see it as a parapharyngeal abscess. Okay, we have Sriraj, Champion, Myra, PK, and Ashish is leading. And let's move on to the fifth question. A 60-year-old male with a history of chewing betel nut presents with progressive trismus and burning sensation in the mouth. Examination shows fibrous band buccal mucosa. Which are the following is true about this condition? So this is a potentially malignant condition caused by the habitual irritant here. It leads to restricted mouth opening. to give you a clue. Right. It is a pre-malignant condition. Okay. So the diagnosis here was oral submucous fibrosis. Here, not much changes. It's more classic question. Which of the following is not an absolute indication for tonsillectomy? So, while recurrent infect, tonsil infection are a major reason, not every sore throat qualifies this. Think of a criteria like frequency, airway obstruction, and other complications. The right answer is chronic tonsillitis without any airway obstruction because the question is asking not an absolute indication. So all others are an indication, but chronic tonsillitis without airway obstruction is the correct. Okay, we have Sriraj in the first place, Myra second place, Ashish in third place. We also have Shanpriyan, A. Naga, Sundar, Aditi, and Dr. Reed Stark. Okay, let's move on to the seventh one. A 7-year-old child presents with torticollis, neck stiffness, and difficulty swallowing for past 3 days. The child had a history of recent tonsillitis. On examination, the head is tilted to one side with restricted neck movement. What is the most likely underlying pathology? So this is a rare but serious and is often secondary to an infection affecting the atlantoaxial joint. So the right answer is atlantoaxial subluxation due to ligamentous laxity. That is Grisel syndrome. Okay, not much change. We have few players. Uh, okay, I think we have guests in the fourth place. Let's move to the eighth question. A 7-year-old child is scheduled for adenoidectomy. Which of the following is an absolute contraindication for the procedure? So this surgery is avoided in conditions where normal elepharingeal function is already compromised, so which may lead to problems with the speech. So here you have to choose the absolute contraindication for this procedure. Right. If there is a cleft palate, then we first do the cleft palate surgery and then later we can do the adenoidectomy. Here we have Sriraj now in the first place, Ashish in the second place, followed in the third place we have S, followed by Shan Priyan, Myra, Bhagya, Sundar, EP, Naga, and Dr. Reed Stark. Okay, you guys are doing well. So let's move on to the ninth one. In a child suspected of adenoid hypertrophy, which of the following lateral X-ray findings is most indicative of this condition? What is the classical X-ray finding which is seen in adenoid hypertrophy? The correct answer is obliteration of the nasopharyngeal air column. Because due to the mass of adenoid which is formed there, it obviously blocks the airway in the nasopharynx. Okay, we have Shiraj, Ashish, and Shanpriyan, the top three, third place. And we have S. Sundar, Bhagya, B. Naka, Maina, and Sri Rama. Okay, moving on to the last question of the quiz. A patient with hoarseness of voice is diagnosed with unilateral recurrent laryngeal nerve palsy. Which of the following muscle remains functional here? So, most intrinsic muscles of larynx are affected except one, which is supplied by a different branch of the vagus nerve and helps in the pitch modulation. Let's see if we can get it. Right, the answer is cricothyroid. Okay, okay so the winner of the quiz today is Sriraj. And congratulations, Sriraj. And we also have Ashish in the second place and Shan Priyan, the third winner of the quiz today. So congratulations, guys. And we also have yes, Sundar, Bhagya, Naga, Maira, Sri Rama, PP, KSM, RDT, RK Shetty, SI, CK, Surabhi, Krishna X, and Dr. Rita. Okay. So congrats, guys. So finally, we have finished ENT today, covering ear, nose, pharynx, larynx, and the neck. So that's it for today. So we'll have a grand quiz on ENT tomorrow. So stay tuned for more clinical questions, the high yield PYQ, and keep on revising. So see you all in the next session. Uh, Thank you for joining and good night.